As coronavirus cases continue to rise in India and around 40,000 new infections are being reported every day, the Central Drug Standard Control Organization has approved 5 drugs to treat COVID-19 patients. Out of these, 2 are antiviral drugs, Remdesivir and Favipiravir, and the remaining 3, Dexamethasone, Tocilizumab, and Itolizumab, are for easing symptoms. The trials to determine these drugs' safety and efficacy are either underway or have ended with negative results. But experts have questioned their approvals in India. Almost all these drugs are highly priced too. The first one is Favipiravir. On the 19th of July, the Drug Controller General of India issued a notice to Glenmark, which makes Favipiravir. The notice was issued for high prices and false claims. Favipiravir was approved for use in India by the Central Drug Standard Control Organization, or the CDSCO, on the 19th of June and is being marketed under the brand name FabiFlu. The drug has been priced at 103 rupees per tablet, so a full course of the treatment would cost somewhere between 15,000 to 12,000 rupees. The notice to the company came as a response to a complaint which was made to the CDSCO by a member of parliament whose identity has not been disclosed. In the notice, the CDSCO stated that the price was not in interest of the poor, lower middle class and middle class people of India. The notice also said that Glenmark has claimed Favipiravir to be effective with comorbid conditions, whereas in reality, the trial was not designed to assess FabiFlu in comorbid conditions and no clinical sufficient data specific to these conditions are available. But this is not the first time Favipiravir has come under scrutiny. Experts have previously raised questions about how the drug received approval from the DCGI in the first place. An editorial by The Hindu pointed out that DCGI's website carried no information of the scientific basis on which Favipiravir had been approved in India. The standard procedure demanded by the DCGI to approve new drugs requires drugs to be tested through randomized control trials. The data conducted from such trials are usually published in a peer-reviewed journal, after which they are subject to scientific scrutiny by the larger medical community. But with respect to Favipiravir, no such data has been made available by the DCGI. Multiple studies published in international journals have also indicated that there is no scientific consensus on the efficacy of Favipiravir against COVID-19. The other thing is that in India, for its phase 3 trials, Glenmark recruited 150 patients with 2 drugs, Favipiravir and Umifiovir. Out of these, 30 patients were treated with Favipiravir. This is a small sample size and it invited serious criticism. Small sample sizes don't make for good clinical trials because the significance of the final data becomes low and hence unreliable. But the DCGI still went ahead and granted approval to the drug in India on the 19th of June. Glenmark's filing with the Bombay Stock Exchange reads that Glenmark received quote unquote accelerated approval from the DCGI for restricted emergency use in India. Even though the DCGI has reacted to the Member of Parliament's complaint on high prices, the reasons for approval of the drug are still unclear. The second drug is Itolizumab. This drug was approved to respond to symptoms of COVID-19 and has also invited a large amount of criticism. Manufactured by Biocon Limited, Itolizumab was approved by the DCGI recently on the 11th of July. It is currently priced at 8,000 rupees per vial, and the total cost of the treatment ranges anywhere between 32,000 rupees to 50,000 rupees. Concerns over this drug's efficacy have also been raised. Currently, Biocon maintains that all patients in the treatment arm of the randomized control trials survived, which means one third of the patients who were not given the drug and provided with standard care died. But experts have again questioned this claim because the trial had only 30 participants, which is too small to predict a reliable result. Dr. Jami Nagaraj Rao, who is a public health expert in the United Kingdom and who has recently written for The Wire, noted that the trial's researchers have not even published data for independent verification. But the DCGI has still gone ahead and given approval to the drug. To conclusively say that itolizumab is efficacious and safe to treat COVID-19, researchers have repeatedly said that it will need to be tested in a larger trial, and the study's results should be published before the press release gets published. The third drug is tocilizumab, the black market of which has recently been exposed. Tocilizumab was approved by the DCGI and is priced at 40,000 rupees to 50,000 rupees per vial. According to an India Spend report, tocilizumab probably has a black market and such a high price because its maker, the Swiss pharmaceutical company Roche, has a complete monopoly on it. In India, tocilizumab is imported and then distributed by Indian generics company Cipla. With the supply of the drug minimal and the cases of coronavirus infections rising by the day, the price of this drug continues to remain extremely high. SP Kalantri, who is a professor and physician at the Mahatma Gandhi Institute of Medical Sciences in Wardha, cited a news report on high prices of COVID-19 drugs in India and asked on Twitter if doctors should prescribe an expensive, untested, and unproven drug with known adverse events to treat patients who are destined to get better on their own. The known side effects of the drug, according to preprint papers of studies, include the risk of reactivating latent and bacterial, fungal, and viral infections. Many other public health researchers have also raised questions on the drug's approval, even though there is little, if any, evidence to prove that they are safe and efficacious. The fourth drug is remdesivir. Remdesivir, manufactured by Gilead Sciences, was approved by the CDSCO on the 1st of June. But a study again published in The Lancet indicated that no favorable results attested to the drug's ability to improve the health of severely ill COVID 19 patients. A study sponsored by the US Institute of Allergy and Infectious Diseases and published in the New England Journal of Medicine suggested that the drug did not affect the recovery of people in Asian ethnicity. Despite these criticisms, remdesivir has been approved for use in India. It is highly priced. Again, it's priced at 5,000 rupees per vial, and the total treatment cost of the drug is expected to be 35,000 to 50,000 rupees. Critics in the United States have pointed out that Gilead, the maker of remdesivir, has previously overpriced groundbreaking drugs like Sovaldi, the first hepatitis C cure, and Truvada to manage AIDS. In May this year, Gilead signed a non conclusive licensing pact with five generic drug makers in India and in Pakistan, following which advocacy groups wrote to the Indian government to rescind patents awarded to Gilead. Indian drug patents are important to have because many countries depend on generic and cheaper forms of drugs manufactured in India. And according to a paper published in the Journal of Virus Eradication, the cost of production for most promising drugs under investigation for COVID 19, including tocilizumab, remdesivir, and favipiravir, should be low, and the drugs should also be made and sold at lower costs so that governments can negotiate prices accordingly. Dr. S.P. Kalantri also said, and I quote, DCGI must insist on RCT evidence and should not approve these drugs based on small sized observational studies. Not only shall we lose an opportunity to test these drugs when the outbreak is on, we shall also be letting loose these drugs without risk benefit and cost efficacy analysis, and they might become standard of care with the passage of time without being tested in a clinical trial. And before I end this video, I want to quote a tweet by Dr. S.P. Kalantri. He says, how many patients will rush to buy remdesivir if their doctors tell them, this drug will cost you 24,000 rupees, will reduce your hospital stay only by 4 days, but won't reduce chances of you dying from COVID 19? They might say yes, Dr. Kalantri notes, fueled by fear, fanned by pharma.